and welcome to Rooted in Yard, where I talk about what it's really like living in Jamaica so that you can know what to expect and how to thrive if you're planning to move here. And today I have something very exciting for you. It's actually a request that came in from a couple of subscribers, so thank you very much for your suggestions. This is the reason I can do interviews like this, so that I can get this information to you. So today I'm interviewing Dr. Knight on illness and disability in Jamaica. So I hope that this interview helps you, and I'm just going to get right into it, get right into asking Dr. Knight the questions. All right, and let's get started. So, Dr. Knight, again, thank you for letting me interview you. I'd like you to tell us a bit about yourself, who you are.
Okay, sure. And thank you for having me. So I'm Dr. Rochelle Knight. I'm an internal medicine specialist. I completed medical school training at the University of the West Indies, following which I pursued residency training at the University Hospital of the West Indies. So I'm a specialist in internal medicine. And yeah, that's why I'm qualified to talk about this topic.
Okay, perfect. So, and I think this is going to be really helpful coming from like a medical practitioner perspective. I think people are really, really going to want to hear from you. So, thank you for sharing your credentials with us. So, I guess my first question is, what, in your opinion, are some of the strengths and limitations of Jamaica's healthcare sector? Because, I mean, we hear a lot about the limitations. I mean, I
Right.
guess, but it would be nice to have like more of a balanced view, because I've never heard from a medical practitioner point of view. So I think this would be very interesting. So, what, in your opinion, what do you think are the strengths and limitations of the healthcare sector here?
Right. So I'm very happy that you included both. Because as you rightly said, a lot of the times, especially in the media, it's the negative side of things and the limitations which tend to get portrayed, and we overlook a lot of the strengths. So let me start there. One strength is that I think Jamaica does an excellent job with public health. In fact, our public health model and how our clinics and vaccination schedules is administered in Jamaica is actually a model that has been replicated in a lot of other countries. So we are actually seen as a leader in that area. So Jamaica has five types of health centers. So it ranges from type 1 to type 5. And you have a clinic distributed in almost every single district you can think of. So during my medical school training and also post medical school or internship, we actually have to do a community health rotation. And that introduced me to some very rural areas that I didn't even know existed. And I've lived there my entire life. So basically, health has been distributed in a way that every single aspect of the country is mapped to a clinic, and therefore that makes public health very accessible. Obviously, in the rural areas, services are going to be a little more limited, but every patient has access to antenatal care, postnatal care, child health, and immunization, which is quite exemplary. Because of those immunization schedules, we have been able to eliminate a lot of communicable diseases, things like measles, mumps, rubella. I don't believe there's a single healthcare worker in Jamaica who has ever met a patient with these conditions. We've also been able to eliminate mother to child transmission of HIV, and HIV is still a problem that we grapple with locally. But we don't have, at least for the past decade or so, we have not had any cases of mother to child transmission, which is quite admirable. And that's something that a lot of third world countries are not able to say. Some other things we do well, we do have a hospital in every single parish. So we have 14 parishes and all parishes have a hospital. The level of care, of course, in terms of what's available at each hospital can vary quite widely, but at least there is an opportunity to access healthcare in your parish. Um, Jamaica also has a no user fee policy at public hospitals and clinics, which means that you are able to see a doctor, a nurse, and certain other specialists free of charge. These other specialists would include practitioners like dietitians and physiotherapists. You don't actually have to pay to see these persons. But if certain diagnostics or certain medicines are required, which are not covered by the public system, then of course that cost would be passed on to the patient or client. Um, One last strength, if I may, we do have a very robust national health fund that does significantly subsidize the cost of basic medicines. So for common chronic conditions, roughly 20 conditions to be exact, things like high cholesterol, diabetes, hypertension, asthma, um, sickle cell disease, certain kinds of heart disease, those medicines are heavily subsidized. So what that means is if you visit a public clinic and then visit a drugstore pharmacy, you can actually access pretty decent care for free of charge, which is quite commendable. No limitations. So as I'd alluded to before, there is some disparity in terms of what is available at each hospital. So um, part of getting a diagnosis would involve doing a test usually. So whether that's an imaging test such as a X-ray, a CT scan, MRI, these services can be quite limited. There are very few hospitals in Jamaica right now which offer CT, and MRI is basically not publicly available. So costs for those kinds of tests will be passed on to the patients and their families. So that's a pretty serious limitation. We are also quite limited in terms of what laboratory investigations are available. So basic blood work can be accessed for free, but certain specialized tests, drug levels of certain medicines, etc., has to be borne by the patient and their families. And in some cases, some of these tests actually have to be sent overseas, which leads to delays in getting back timely results. And since we can't act as medical practitioners without, these results to, arrive at a diagnosis, we can't know what to do sometimes. That's usually where patient you know, tend to complain, and that's where we tend to fall short. Just our diagnostics, our capabilities are certainly quite limited. Um, so yeah, I would say though that is the biggest limitation we're having. Diagnostics at this point and certain therapies are not publicly available. There are some medicines as well which sometimes do run out and can be quite scarce.
Okay. Yeah, thank you. That was like a wealth of information. Thank you so much for sharing that.
Sorry.
Especially the fact that there's a hospital in every parish. You know what? I have been quite ignorant because I didn't really realize that. And you know why? It's because I always hear people talking about either they go to town, as in they go to Kingston to
Yeah.
go to the hospital, or they come to
Mhm.
Mobay to go to the hospital. I have not heard of hospitals anywhere else. So I
Yep.
was like, are there like two main hospitals in Jamaica and the rest are like very small clinics or something?
Mhm. No, we have a lot of hospitals. So every parish has at least one, and there are some parishes such as St. Mary, and Manchester, which actually has more than one. The bulk of the specialist hospitals, though, they are located in Kingston, which is oftentimes why persons will travel into Kingston. So the only psychiatric hospital for Jamaica is based in Kingston. Our only chest hospital, the National Chest Hospital, which handles any lung and heart conditions, it's only based in Kingston. So you may have a diagnosis made at another hospital, but you would be referred to the National Chest Hospital as your final, referral point for surgery and for certain experts care decisions.
Okay. Okay. Thank you for explaining that. That explains it. Because I'm like, why? I only hear about
Mhm.
these two hospitals. I guess there's not really hospitals in other parishes, but there
Mhm.
are. There are.
Yeah.
Yeah. Okay, that's really, really good to know. Um, I think there was a follow-up question I wanted to ask about the limitations, but I forgot. But if I remember, I'll get back to it. So my next question, I guess, would be like, the typical wait times for specialists. So you just mentioned like a lot of the specialties are going to be kind of concentrated in Kingston.
Yeah.
Yeah, in terms of the wait times, what can people expect if they needed to see a specialist?
Okay. And to be clear, we're talking about the public system because there is a private
Okay.
system as well where care can be a little more quick. But in the public sector, it ranges anywhere from 3 months to as long as a year for the average specialty clinic. So specialties like, let's say, maybe internal medicine or general surgery, where there are more specialists in that area, you may wait maybe around 2 to 3 months. But for certain highly specialized services, no cardiothoracic surgery or certain subspecialties of surgery, certain subspecialty areas too, like let's say nephrology, cardiology, neurology, you can wait as long as a year. So it really does depend on what specialty you're trying to access.
Okay. Okay. Thank you. Um, and so this next question I have, I'm gonna say I think I know what the answer is, but I just want to confirm. A question is if there are hospitals or clinics in Jamaica that are known for managing like chronic or complex conditions. I'm thinking those would be in Kingston. I don't know if there'd be any in Montego Bay, like the was it Cornwall Regional Hospital, but I'm thinking they would all be in Kingston, or maybe like Kingston and maybe a little in Mo Bay. But I'll have you confirm.
Yeah. All right. So, for me to explain that, it's probably best I break down how the hospitals are structured. So we have hospitals graded as either type A, type B, or type C. Type A hospitals are the hospitals that offer the bulk of services. So that would be namely the Kingston Public Hospital, the University Hospital of the West Indies, and also the Cornwall Regional Hospital in Montego Bay. So of the three type A's that I just mentioned, two of them are located in Kingston and Cornwall being in Montego Bay. The challenge with Cornwall, they've been in the news a lot and they have a lot of resource constraints right now in terms of space. The main building has been abandoned for over 10 years based on public health safety concerns, air quality, and so on. So, Cornwall, while it is still listed as a type A, it would have severe limitation in terms of what it has been able to offer for around a decade or so. So yeah, so specialty services are mostly gonna be found at those hospitals, the type B hospitals, and there is one in each health region. So Jamaica is divided into four health regions, sorry. So that's namely the Northeast Regional Health Authority, which spans Portland to St. Anne. Then there is the Southeast Regional Health Authority, which spans from St. Thomas over to St. Catherine. Then there is a Southern Regional Health Authority, which spans from Clarendon over to St. Elizabeth, and then Westmoreland, Hanover, and St. James falls under the Western region. So I say that to say there is a type B hospital in each of these regions, right? So in other words, there are roughly that would be four type B hospitals. And these are the ones that will offer again not as many specialty services as a type A, but a little bit more than the type C would offer. So some of them will have clinics like a kidney clinic, so nephrology. They would offer things like gastroenterology. Some of them offer ophthalmology, which would be eyes, and a few other specialty services. No, the type Cs are mainly staffed by general practitioners and very few specialists. So specialty services, again, while the bulk of them will be, concentrated at the type A facilities, which are only in Kingston and Montego Bay to some extent, you can still access some amount of specialty care at your type B facilities, and there's one in each health region.
Okay, thank you so much for explaining that. I'm like, this is so much information. I'm like, I am learning as much as the people watching right now. I had no idea about all this information, and it's I'm like really appreciative because I'm like, this is coming from a credible source. Because I could try and go do some research, but then I don't always, I don't always know. So it's nice that all of this information is coming from a very credible source. So I really appreciate like the time you're taking to even explain certain things. You're like, okay, when I say this, this means that. So I just wanted to let you know I really, really appreciate that.
You're most
Um,
welcome.
yeah, so the next question I have is whether medical records like from abroad can be easily integrated into like the Jamaican care system, because I know there are some people who are watching who they have, chronic conditions, they have illnesses, they have disabilities, there's certain medications they need to take, etc.
Right.
So that is something that I'm curious about, and I'm sure they would be curious about.
Yeah. Okay. So, unfortunately, at this time, majority of the clinics and hospitals in Jamaica are still very paper-based, which means we haven't yet moved on to having electronic medical records at most facilities. That being said, if you're able to access a printed copy of your records, or if they can be, emailed. So quite often, the patients that I interact with who are coming from abroad, they have something in their email or electronic. What I usually advise these patients is to have it printed. That way we can actually add it to their paper-based docket for, just ease of reference. So it can be integrated, but we're not yet at the system of having electronic records readily available at most facilities.
Okay, but it's good to know they can at least print and
Yeah,
bring it with them. Okay.
yeah.
Okay. Okay. So then my next question is regarding the medications. Are there common medications for autoimmune conditions? Are those readily available in Jamaica? Because I know I was reading something about some medications that people would use being illegal, but I'm like, okay, maybe those ones are illegal, but like, are there adequate alternatives for certain medications here for certain conditions? Are the medications safe? Because I know that's also a concern with people who are planning to move here.
Yeah. All right, so I'm happy you mentioned autoimmune disease because autoimmune diseases have, evolved in terms of how they're being managed, where a lot of persons are now on an injectable agent or what would call a biologic. Um, to be frank with you, biologics are not readily available in Jamaica yet. They can be imported once you have a letter from a physician or you have the actual prescription that ordered that drug. But sometimes there can be issues in terms of transport. So some of these biologics have to be transported in a certain way to make sure that they remain safe, whether that's refrigerated, etc. So you can import biologics, but we haven't yet reached the point of having a lot of them readily available. We probably have maybe I would say around 5 or 6 common biologics available, but for certain autoimmune conditions such as multiple sclerosis or Even some of the drugs used for SLE, which, have now been, let's say, FDA approved, if we're talking about the US, we don't really have those drugs here as yet. What we do have, though, are the tablet forms of immunosuppressants. So, specific to autoimmune diseases, things like your steroids, things like, your mycophenolate, certain more common tablets used to manage autoimmune diseases, we have those here. I should point out though that the brand names can be different. So a lot of drugs will have, different names depending on what region. So it's the same drug, same ingredients, but the brand names are different. So let's just say the same drugs used in like the UK and Australia, we like let me give a classic example, Clexane or enoxaparin. It's marketed as Clexane in the UK and Australia. We import from GSK, so we will get, you know, um, the same brand that they have. But in the US, for instance, they will use, they have their own suppliers and their own manufacturers. So it's the same drug, but different names. Unfortunately, patients tend to know the brand name a lot more than the generic name. So that can cause a lot of confusion where they think they're getting a different drug, but it's actually really the same drug, just a different manufacturer, but same ingredient or molecule. So, what I would say is always good to just ask the right question, speak to your doctor, check because the name could be different. You know the drug by a different name, but it may actually really be the same drug. Um, no, all drugs which are on our market do undergo, safe rigorous testing and scrutiny to ensure that they're safe. So while the name may be unfamiliar, it doesn't mean that it's any less effective or any less safe than brands that you may already be familiar with.
Okay, thank you. Thank you for explaining all of that. Um, just a quick question there. So, if a person were to, let's say, bring a medication and over here it would be under a different name, is that something they could just show their physician and ask their physician, or would they have to go to like, because I know in some places, like I don't know, in Canada, a doctor may prescribe something, but then sometimes I might have to go to the pharmacist and ask the
Mhm.
pharmacist certain questions, and the
Yeah.
pharmacist would give me information about certain interactions that my doctor didn't tell me about, or they may, I don't know, the pharmacist may give me some information like the doctor prescribed something, but so I wasn't sure if it's kind of like they can ask the doctor, or would they kind of have to maybe talk to a pharmacist first, or
They can do both. So the thing is, if they're trying to fill a drug, they'd have to have a local prescription because our pharmacists are only allowed by law to dispense drugs which are prescribed by someone licensed to the Medical Council of Jamaica. So, in other words, they would have to see a physician in the first place to have their prescription rewritten, right? By someone who has, the authority to practice locally. You can't fill a Canadian prescription or an American prescription here, right?
okay.
So what I'll say is you can ask the question to either your doctor or your pharmacist or both. Yeah, I think it really just depends. Any member of the healthcare team who you interact with, you can ask any question and have those concerns addressed.
Okay. Okay, that's very good to know. Um, thank you. Thank you. I really appreciate that. Um, your explanations are so great. I just have to say that. This is, I like this makes it so much like the way you explain, I just feel like it's so much easier to understand. Um, okay, so now my next question is kind of about money. So in terms of like a realistic monthly healthcare cost, if there is someone who has ongoing needs, I don't know if you, it's kind of broad, I know, but I don't know if you'd happen to know a
Yeah.
range, but that's something people think about, especially Americans. Although,
Yeah.
when I talk to a lot of Americans, I just feel like once they leave the US,
Mhm.
healthcare is just going to be cheaper automatically. especially ongoing. But I don't know if you have like any sort of if there's like a range of like monthly healthcare costs for someone with ongoing needs.
Right, right. That's a very important question. And again, it's going to vary depending on the condition. So let me start with more common conditions now, things that we see every day: hypertension, diabetes, high cholesterol, asthma. If you're going to see a doctor in the public sector, and access a drugstore pharmacy, which is linked to the National Health Fund, where medicines are heavily subsidized, it can range from as little as free, but if you're going to go the private route, because the wait time can be quite long, when you go to the clinic, it's notorious for being a whole day event in that you have to go there early. Everyone gets the same appointment time. So you may go there as early as 7, but not leave till 12. That's just not practical for everyone's schedule. So if you're going to go the private route, seeing a general practitioner can be maybe around 5,000 Jamaican dollars. Seeing a specialist may be around 15,000 Jamaican dollars. Now, these are the average prices. And filling your prescription can range from anywhere to, I would say, maybe as little as 5,000, can be a little less, but around 5,000 would be the lower end to expect, and it can be as much as 15,000. And this is if you're filling common things now, like antibiotics or blood pressure tablets and so on. Now, for more chronic things, for more serious illnesses, let's take for instance chronic kidney disease. If you need things like dialysis now, you can rack up some very, very high medical bills quickly. um, Dialysis right now per treatment session is around 15,000 Jamaican dollars, and you'd be needing around 2 to 3 treatment sessions per week. So you can do the math to see that that would be the higher end of what to expect. That could be anywhere from 200,000 to 300,000 Jamaican dollars per month. So the costs vary very, very widely depending on what illness we're talking about. What I would say though, for anyone who is returning home, anyone with well, first of all, you're going to need a TRN. That's a tax registration number. So for anyone with a TRN, and you're seeing a doctor, whether publicly or privately, do ask for them to enroll you in the National Health Fund program once you have one of the 20 plus chronic conditions that they cover. That will really, really subsidize the cost of your medicines quite a bit, especially if you're planning to fill your prescription at a private pharmacy. Yeah, so you can actually save quite a lot of money once you have an NHF card, but you need a TRN to be able to access that.
Oh, okay. So is it just a TRN? Like, would they have to? Well, I'm assuming they would need residency first.
Mm. So, okay, it's a gray area. Yes, you should be a Jamaican citizen, but it doesn't really ask for that. What the form requires you to provide is really your TRN, a place of residence, and your contact information. You'd also need a doctor to certify that you do have one of the eligible chronic conditions, but I don't really believe they're asking for much more. I think because once you have a TRN, the thought is that you're paying taxes in some way, or you're, contributing to the economy. So
Yeah.
it's really not that hard to get an NHF card at all. So I would really encourage anyone returning home once you have a TRN, yeah, sign up. And if you're over the age of 60, you do get further subsidy with the Jamaica Drug for the Elderly program, abbreviated to JADEP. So between NHF and JADEP, if you're over the age of 60, you can save quite a lot of money. In fact, I know elderly persons who are paying as little as 200 Jamaican dollars at private pharmacies, and their prescription has like 7, 8 drugs on it, just because they have their NHF and JADEP. And I say that to say, again, it's not every chronic condition which is covered, but the more common things, hypertension, diabetes, asthma, prostate disease. Yeah. If you have any illness that falls on that list, and the lists are available online in terms of what conditions are covered. Once you have an illness that falls under that, go to your doctor, make sure they fill out an NHF form. By right, your doctor should be asking you. I tend to ask, I try to remember to ask all the patients I see if they have NHF card or not. But once you have a condition that, you know, is covered, ask. Sometimes your doctor may not remember. In fact, even if your doctor doesn't remember you, pharmacists really are such a vital part of the team. I have had pharmacists literally pick up the phone and say, "Hey, doc, I'm seeing a patient that their card hasn't been updated to show that they now have prostate disease, and I see you write them for a prostate tablet. So I'm gonna give them a form that they should carry back to you to fill out so they can save more money." Yeah, pharmacists are the real MVP. So if your doctor doesn't ask, sometimes your pharmacist may pick up once they see you paying these exorbitant, costs for medicines. They will pick up that, hey, this person can save money. They're losing out because they haven't yet gotten an NHF form filled out. So yeah, NHF is really a big game changer for persons with chronic conditions.
Wow, and that makes me think because I know there are some people who want to move over with their elderly family members or with just older family members who have some chronic conditions. And these older family members are also like Jamaican.
Yeah.
But that's one thing that they feel is holding them back is they don't really know much about the healthcare system here and they are very concerned for
Yeah.
their relatives. So even that, just knowing that that is available,
Yeah.
the TRN kind of surprises me. I mean, it kind of doesn't because I'm like the TRN is kind of used for everything, but I was like, oh, like they need it for that too. Okay, that's good to know. But I think that is really helpful information. So, especially for the expats watching this who have relatives, you have your elderly relatives who you all want to move to Jamaica or they're Jamaican and you want to bring them back. You all want to
Yeah.
move back. This is something very positive. Um, and I love that, even if the doctor kind of misses something or forgets and prescribes something like that, the pharmacist will be like, hey, wait, you're paying a little too, this is going to cost you a little too much. Let me bring up the doctor. I think that's really, really
Yeah.
nice.
I
Yeah.
think so too.
Yeah. Um, okay. So I'm just going to move on with some of the rest of the questions because I'm like, this is so juicy. I have so many more questions.
We need to
um,
do a part two.
yeah,
Yeah.
probably. We'll see. We'll see. Um, So my next question is, well, let me see. I think you kind of actually answered this because the next question was going to be about government assistance for people with disabilities or chronic illnesses and what type of
Mm,
support they can expect. Actually, I think this question is still relevant. I think you answered a part of it in terms of like the costs, but
yeah.
I don't know if there's any other type of assistance for those with disabilities or chronic illnesses in terms of the support they can expect. Like, can they? Are there home health care services? Are there personal care aids?
Mm.
Anything like that?
Not quite. So that's another area that we're lacking in, I would say, locally that fall under limitation. We haven't yet gotten there in terms of our rehabilitative, kind of services. Right now, we don't have like an ambulatory care service either. So accessing healthcare publicly would require physically going to a facility as opposed to having that service come to home. So as a result, persons with disabilities, persons with mobility issues, cognitive issues, it can be a little more difficult to reintegrate in Jamaica. But we do have some councils that will provide like financial assistance and just other, well-being, like wellness checks and so on. So there is the Jamaica Council for Disabilities. There is the Blind Society of Jamaica, and there's also one for persons with hearing disability, where they will provide, grants and just basically some wellness checks and so on. But it's not a very robust system yet, the way I know exists in some first world countries.
Okay. Um, but I wonder, I am curious if, like, this is an offshoot question, but I'm curious if, like, privately, I think there would be privately
Yeah,
people
so
could get that
privately,
care.
oh yeah. So I should say that sometimes yeah, but privately that definitely exists. It can be quite costly though. In other words, so some persons will go through like a nursing company to get like a nursing aid or like a registered nurse to come in and do whether administering medicines or like dressings if there's like a wound and so on, but the costs can really rack up because minimum wage in Jamaica is at least what you're going to have to pay an individual to come into the home for, up to 40 hours, like a 40-hour work week. If you're having someone there in the daytime, like let's say from 9 to 5, you'd have to pay them at least what is the current minimum wage, which don't quote me, but I believe it's around like 15,000 Jamaican or so per week. So you're looking at least a minimum of 60,000 up per month to have a caregiver. And if this is a person who, let's say, they require more supervision than a regular 40-hour work week, let's just say you need someone in the daytime, someone at night, then you can do the math to see how much those costs can quickly accumulate. Yeah. And also, if they need, let us say, like physiotherapy, so we do have mobile physiotherapy that will come into the home. So that's another thing to consider if you have, mobility issues, but the costs can really stack up pretty quickly.
Okay, okay, thank you for clarifying that. And in terms of just the mobility issues, um, in terms of devices to assist with
Yeah.
that, are they easy to obtain here in Jamaica?
Privately,
Okay,
yes. So we don't really offer devices, implants, that kind of thing. They're not available in the public sector. But privately, yes, for the most part, these things are available. And they're private companies mainly based in Kingston, but you do have a few in like uh other towns, so like Mandeville, Ocho Rios, of course Montego Bay as well. You'll be able to have private companies that sell these devices. No, if we're talking implantable things, no. So like cardiac devices, that's a little different. We tend not to have those readily available. Those tend to be imported on a case by case basis. So regular things, no, like your let's just say your eggshell mattress, your mobility aids, wheelchair, crutches, even things like hearing aids. You can get those things here to purchase, but special things not like your cardiac devices, those would have to be imported.
okay, okay, that makes sense. Well, that makes sense based on what we've been talking about is available in Jamaica.
And the thing is too, I think why even certain things have to be imported on a case by case basis. We have less than 3 million people, and these things are also quite costly. So importing them and having them just sitting there gathering dust or passing their shelf life and expiring, that's just not economical. So that's the reason why for certain high specialty equipment, those things will be imported on a case by case basis just for economical reasons.
Yeah. Okay. Yeah, that makes sense. Especially as you said, considering Jamaica's size, which I
Yeah.
don't always remember because anywhere you go in the world, you can find a Jamaican. You could, I'm thinking you could probably go to Antarctica and you would find at least one.
Yep, I don't doubt it. Yep.
Yeah.
Yeah.
Okay, so I have a few more questions. But this one I think is pretty, I think we've answered it, or maybe people have picked this up. What I wanted to ask is if someone has a chronic illness or disability, where in Jamaica would it be best for them to move to? Because I know people kind of, when they
Mhm.
come here, they want to go different places, but um, if they have a chronic illness or disability, I'm thinking the best place for them to go to would be Kingston. But
Yeah.
I don't know if there's like a second, is there like a second place or a third place maybe that they could also consider?
I would say just make sure you're close to a hospital, close to somewhere that has at least a type B hospital. So
Okay.
the type B hospitals right now are located in St. Catherine, so that's a Spanish Town Hospital. There's also the Mandeville Regional Hospital in Manchester. There's a Senans Bay Hospital as well, which would service areas like Ocho Rios. So I would just say make sure that you're close to an urban center that has a hospital at least within a 30-minute drive. I'd also recommend having access to a vehicle. So even if, you know, let's say for whatever reason you may not have a personal car, but at least having like a taxi driver, somebody who is reliable in the event you have an emergency. If that's not possible, then I would say ensure that you have a contact number for an ambulance. We don't have we don't really have what would I say, like a national ambulance service that readily available, like paramedics and so on, are not readily available in the public sector. Yes, you can call, 110 and hope that you get through, but I would recommend having contact for a private ambulance just in case you're not able to get through to our public emergency services.
Okay. Thank you. That's really good to know. This is such good information to know. I had no idea about all of this. So I'm like I am learning with the people who are also watching this. Um, okay. So my next question, I think this is probably really, really important, um, is for those who have chronic illnesses, how best, like they're listening to this and they're thinking, you know what, I think I can swing it. I think Jamaica could work. How best can they prepare prior to coming here? Or like I don't know, what would you recommend they prepare prior to coming here? I know you mentioned about printing the medical records, so that's one thing
Mhm.
someone can do. I don't know if there's any other things you would maybe recommend them doing or taking with them.
Yeah. So printing medical records, as you already said, also ensuring that they carry their medicines in the original container. Sometimes I know persons may take things out, put, everything together. They want to label, oh, these are my medicines that I take in the morning and in the evening, but the names of the actual medicine is not there. So it's hard to look at the pill and know what's what. I would say carry the original labels and containers in which the medicine was prescribed. And next thing, so try to have at least a minimum of a month of medication. If you can get even 2 or 3 months worth initially, would be good because if you're gonna access, especially a public like a health center, you may not be able to see the doctor right away. When you go, you may be given an appointment for like a month or so in the future, and you don't want to run out of medicine. So try and carry some for that initial move. I think that would be, yeah, that's pretty much it. Oh, I remember what I was going to say now. Make sure that you have the names down at least of the closest hospital closest health center, you can just Google it, health center near me or clinic near me or hospital near me, just so you have an idea where to go. And the Ministry of Health and Wellness actually should be able to tell you if you Google and you find which clinic is the closest one, you can Google and see what services are offered there to see if that facility is actually able to assist. So let's just say you Google and you see that you're close to a type 1 or 2 health center. They may not have a doctor on every day of the week. So you therefore have to try and contact the clinic to see, okay, what day can I come to see the doctor? Other days of the week, they probably only have a nutritionist or a midwife, and they may not really be able to assist. So knowing what health center is closest to you, and what services they offer is very important.
Okay, thank you. And that sounds very, I feel like that sounds pretty easy to do for someone coming here with a chronic illness. It's like they don't have to do too much. Maybe like do some Googling, print some papers, bring some medication. That doesn't seem too cumbersome, so that's sounding really good. Um, and speaking of illnesses and disabilities, are there certain conditions that, in your opinion, would be easier to manage in Jamaica over others? And are there any conditions that, if someone had, you maybe wouldn't recommend relocating to Jamaica? Like in my opinion, because I know people personally who have a hearing disability. They're
Mhm.
hard of hearing or they can't hear at all. And it seems to me they seem like they're good. They don't really it doesn't really seem that it impacts them too heavily in their day to day.
Yeah.
But I am curious, in your opinion, if there's any illness, like chronic illnesses, any illnesses at all, or disabilities that may be easier to manage over others, or any that you're like, you know what, maybe like rethink Jamaica. Maybe not that one. Jamaica isn't for everybody. Maybe not that one.
Yeah. All right. So for those illnesses that maybe only require a doctor's visit every 6 months to a year, those are pretty easy to manage here, right? Because that would mean that you're able to do the bulk of the care, on your own, or maybe you're well controlled. You just have to remember to take your medicines. So I would say if your follow-up visit is every 6 months to a year for a chronic condition, you're good to go. Conditions where I would say probably reconsider relocating are those persons who, if you require dialysis, unless you are able to, afford to pay for your treatments out of pocket, or if you're very fortunate to have an insurance policy from where you're from originally and coming back, that would cover the cost. I've never really met anyone that fortunate, but if you have that system in place where they will cover the cost of your dialysis in Jamaica, then fine, you're not the subject of this convo. But if you have to pay those costs out of pocket, they really do rack up quite quickly. As I said, dialysis now is roughly around 15,000 per treatment session, which means roughly 45,000 per week. You can do the math. That's very expensive to manage here. And also anyone with an autoimmune illness that requires a biologic that's not readily available. I mean, we have the common things like Humira, but if you're on some of the other biologics which are not yet locally available, I would say reconsider. And lastly, for certain kinds of cancers, if you're, dealing with cancer, I'd recommend not coming here until you're in remission, just because cancer care can be pretty expensive and sometimes also a little delayed in terms of shortage of oncologists locally. Um, Oh, how could I forget transplants? If you're a transplant recipient, be careful. You can come, of course, to visit, but some of the immunosuppressants needed to maintain a transplant and some of the very rigorous lab investigations needed to maintain a healthy graft, I would not recommend relocating here at all.
Okay.
Visiting is fine, but not a full-term relocation for the average transplant. If it's a kidney transplant and you're planning to be based in Kingston, where we do have a transplant clinic, if it's a kidney transplant, let me be frank, kidney transplants, we do have kidney transplants done locally. But for any other organ transplant, whether it be heart or bone marrow or lung, I would not recommend coming back at all.
Okay. Thank you very much for your transparency and honesty there. Um, Yeah, because I feel like people need to, like, that's part of my channel. I want to let people know, like, the truth. I'm
Yeah.
not trying to, like, hide anything from, I don't want to just say, yeah, everybody come to Jamaica. Everybody, it doesn't matter.
Mhm.
Everybody. I'm like, no, no. I feel as though you need to come and be aware if
Yeah.
you're going
You need to
to.
know what you're gonna find when you're here, you know? And I know across the board, sometimes Jamaican healthcare gets a bad rap. We really do some things well, but I'm gonna be frank in saying there are other things that we're not yet doing well, whether it's based on lack of resources or shortage of specialists. It's just the truth. So for common conditions, sure, you can come. But if you have things which are a bit more complex, I would say reconsider.
Okay.
No,
Okay.
for now. Because things are
Yes.
always in evolution. Yeah, there has been progress. I have seen even improvements. I've been in healthcare now for 7 years, 7 years in practice, and I have even witnessed some improvements already. So that's just to say that things are dynamic and yeah, what's not available today could probably be different in another 5 or 10 years from now.
You know what? You're right. That's very true because I also know there are expats who want to move back who have experience like in the medical field and they want to actually, like, we always talk about the brain drain in Jamaica, but I have a friend recently who created a Facebook group about like the brain gain in Jamaica and how more and more people are starting to move back with their
Yeah.
skills and they really want to, even if they don't have any like ties to Jamaica as in familial ties, they still want to move here
Mhm.
and they want to improve the lives of people here. They want to use their skills to do that and they want to actually put their money into the economy to help. So you're right. If it's, maybe if it's not right now, it doesn't mean not forever. So, you know? So I only have a couple more questions left.
Okay.
Well, really, this technically is I'll just say it's a couple more questions. So the second and last question really is there anything that you wish patients knew before moving to Jamaica with a chronic condition, illness, or disability?
Mhm. I would say we touched on most of them. I would just really want people to know what they're getting into. Know the strengths of the system, know the limitations, and just come with an open mind. Um, just because you may have read a negative, media report about a certain facility, don't use those preconceived notions to judge a place. Come with an open mind. Because quite often, I work publicly and I'll have people say, oh wow, I never expected the care here to be so good. And I'm just like, wow, gee, thanks. It's a backhanded compliment. So I'll take it. I'll take the good of it. But they say things like that just because of what they hear. And yeah, I'm not gonna say that the system is perfect. It's not, but we do some things well. So come with an open mind, do your research before coming as well.
Okay. Um, and well, this is okay. This is kind of an offshoot question that I was thinking about. Um, I'm not sure if, I'm not even sure if I should ask you, but I'll ask you. We'll see. The question I had is just about, because I know there's like a lot of like teas and stuff, like there's a lot of bush medicine that some
Mm-hmm.
people can take to help with certain things.
Yeah.
But I don't know. What am I trying to ask? I wanted to
You want to know if
ask,
it's safe?
like, I guess if it's safe enough to consider, like, I know there are some, I've heard of some practitioners saying, you know what, I think like some tea would just, like this particular tea would help with this particular,
Mm-hmm.
condition or this particular thing. So I don't know if you have an opinion about that. I just was curious.
Yeah. Oh, for sure. Listen, I am fully, how do I put this the right way? I believe in honoring your roots, right? I will never disregard the fact that there are natural things out there that really do work wonders. In fact, there are some conditions where natural remedies may probably even work better than anything that I can prescribe, right? But at the same time, we have to be careful. There are lots of natural remedies out there. People will say, "Yeah, man, this bush good for this and this tea good for that," but how much? In what quantities, prepared in what way. The studies for these things sometimes can be quite limited. So I would say for common ailments, no, for like the common cold, I swear I am a doctor and I swear by leaf of life, right? I think it works better than any thing I can prescribe. So for common ailments, and for mild conditions, so let's say you have hypertension and you want to drink your coconut water or you want to take your garlic tea, that's okay. But you need to make sure it's working for you. So it's not just to use a natural remedy and that's it, like in isolation. No. Do your checks, see if it's actually working. You're using garlic for your pressure, have a blood pressure machine, check to see is it actually working or do I need to now take medicine? So everything in moderation. So use your natural remedies for common, milder type of ailments. But if you find that it's not working for you, do your checks. If it's not working, see a doctor and consider the traditional medicine. I don't knock natural medicine. In fact, most doctors don't, but they just want you to share what you're using, because some of these natural medicines can actually work negatively. They come with side effects, liver damage, and so on, depending on what bush. So just have an open conversation. It's not, don't be ashamed to say, I'm using this doc. I'm not taking this pill anymore, or I'm taking this pill, but I want to know, can I use this? Just ask, there are some drugs that can, be affected if you take certain teas and stuff with them. So just have an open discussion. You should feel comfortable enough with your healthcare provider. And if you're not, then see someone else. You should be able to talk about what you're using and get advice as to whether it's safe.
Okay. Thank you so much for saying that because I was very curious because I've never had a medical practitioner. I've never asked them. I never like
People think that we look down on natural medicine. And no, like I'm Jamaican too. I grew up with my grandma or, mother telling me this good for that. Like I am raised here. I'm steeped in the culture. I know what's what. I'm not saying I know everything. Obviously, I don't know every bush. Sometimes I still have people come and ask me about things, and I'm like, "What is that? I've never heard of that." And I have to even Google, like, "What bush is this? What does it do?" And see if there are any studies. The danger, I would say, though, is that some of these things have never been studied, and therefore we don't really know what quantities are safe. So for mild things, I would say it's fine, but for more serious things, definitely have a discussion with your doctor.
okay. Thank you so much. So I just want to know if there's anything else you wanted to, mention or talk about that we hadn't discussed that you think is important for people to know.
I think we covered
We
more or
we
less
did. We
everything. Yeah,
covered quite a bit.
I
We
think we
did.
did.
I
I
just
think
wanted to
we
give you the opportunity, just in case you're like, oh, there was this one thing I really, 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 really wanted to mention.
did.
Um, okay, so yeah, that is pretty much it. I'd like you to kind of, kind of shout out yourself maybe shout out yourself or any organization or anything that you want to shout out. I want to give you an opportunity now. And if people want to reach you, if they want your help,
Yeah.
I'm just giving you the opportunity. Go ahead.
Okay, sure. All right. So in terms of social media, you can find me on Instagram at Dr. Rochelle Knight. So that's my actual name. You can look me up on Instagram. I don't update as much as I should, but I'm aiming to be more active this year in terms of just sharing healthcare advice. So you can give that page a follow. And also in terms of privately, I am partnering with some colleagues and we're starting a medical spa. It's called Bellissimo Medical Spa. So I'm an internist, so I see chronic conditions. But my colleagues there will be offering other services such as hair transplants and health coaching, etc. So you can look up Bellissimo. We're on Instagram, and there's also a website where you can learn more about the doctors, myself, and the other doctors who are a part of that new exciting clinic.
That's amazing. So, for anyone who's watching, if you are interested, I will ensure that there are links in the description and probably in the comments as well, probably in the pinned comment as well. Um, yeah, but I think this was great. This was fantastic. Thank you so much.
You are most welcome.
Okay, so that is it from me today, or from us today. I really, really hope that you found this interview helpful and informative because that was the whole purpose of the interview. If you did, do hit that like button to let me know and let Dr. Knight know. I also do want to hear from you. If you are Jamaican or you are living here or you're planning to move here, I'm curious to know if there are things that maybe you learned from this interview. If there's anything else that you think people should know, definitely share it in the comments. If you're planning to move here, I'd love to know if you found this informative because I did create this for those who have chronic illnesses or disabilities and who would like to move here, but they're kind of afraid and they don't really know what to expect. So I really, really hope that this helped you. Please do leave a comment to let me know and also to let Dr. Knight know as well. And as I mentioned, the links for the links for Dr. Knight and the website that she mentioned will be in the description and in the pinned comment. And before you go, okay, I have some freebies. Those will be on my site. I have linked those in the description. It might be in the pinned comment as well as if you are ready for even deeper support. I do offer a few things. I offer personal relocation guidance. So I do this through voice notes or 1 hour consultations. You kind of just choose the level of help that you need. As well as there is my Moving to Jamaica starter guide. That is complete. I may add more information to it later, but for now it is complete. There is also the Rooted Together. This is kind of a new thing that I'm doing. It's the Rooted Together. It's kind of like a community. I want to say it's like a community. Essentially, it's for the people who want to move to Jamaica, who seriously want to move to Jamaica, or they're seriously considering moving to Jamaica. It's to connect you with others because what I don't want is for you to come here and feel alone, because that's something that a lot of expats experience when they move to a new country, or even repats, right? Where they move to a new country and they don't really know anyone. Like they're trying to get to know people, but they don't really know. So this is to help with that. We have weekly meetings where we get on, video call. I guess you don't have to show your face if you don't want to. It's up to you. But essentially we have a virtual call every week where we kind of, get to know each other and we're building friendship and we're building community. So that's what Rooted Together is for. So that is available for you as well. And the links for all of that will be in the description and likely in the pinned comment as well. Okay, so other than that, I really, really appreciate you being here. I do have some more interviews coming up. For example, I'm going to be interviewing someone else who has a chronic illness or disability. They will be, the interview will be from like their perspective. You just heard from a medical practitioner perspective. But from an individual perspective, they're going to be talking about their experience. I'm going to be interviewing them. I'm also going to be coming out with some interviews for those who have children and they're concerned with schooling and how that works here in Jamaica. I'm going to be interviewing someone here about that, as well as I'm going to be interviewing an expat in Jamaica on their experience of building community in Jamaica. And I'm going to be asking them some questions about that. So there is more to come. There's a lot more to come. And if you are interested and you don't want to miss any of those conversations, if you haven't subscribed already, I would recommend subscribing, as well as there is a when you subscribe, there is like a notification. You can set your notifications so that you will be notified. Sometimes YouTube doesn't always notify you when the videos come out, but you can actually select that in your settings, or when you subscribe, there should be a little option to select getting notified. So if you don't want to miss it, I would suggest subscribing if you haven't already and turning on your notifications. Otherwise, you can join my newsletter. The newsletter is completely free, and I am becoming more active on there, and I want to be sending out at least every time I'm gonna do a video, I want to be notifying you via email, just in case YouTube doesn't always notify you. Again, the newsletter is free, and I'm also sharing like some free tips and information as well. So if you're interested, the link for that will be in the description and in the pinned comment. In the meantime, let me know if you have any suggestions about what you'd like me to talk about, or maybe if there's someone you would like me to interview about a particular topic. Do let me know. Other than that, I really appreciate you being here. I'm very grateful for you being here, and I'll see you in the next one.